big mistake most people are making regarding magnesium. Your blood levels show normal magnesium levels. What a lot of people don't know is only 1% of all your magnesium in your body is inside your blood. 99% is deep in your cells. When your body is deficient in magnesium, it'll rob magnesium from your bone, your muscle, and put it in the blood, giving you the illusion that you have enough magnesium if you're just relying on the blood test. There are more sophisticated, advanced ways to determine if you're magnesium deficient, but I'm going to give you this simple way to figure it out. If you have any muscle spasms in your body, muscle twitch underneath the eyelid, anxiety, poor sleep, sugar cravings, and definitely Charlie horses are all clues that you're deficient in magnesium. Typically with the diet, you need about 400 milligrams of magnesium every single day. Almonds are high in magnesium, but you would have to consume 5 cups of almonds to get that 400 milligrams. Or you can get your magnesium from spinach, but you would have to consume 5 big handfuls of spinach just to get 400 milligrams. What about chocolate? Isn't that high in magnesium? It's sort of high, but you would still need about 4 bars of chocolate to get your daily amount of magnesium. On top of that, there are many things that don't allow us to absorb even the magnesium from the food that you eat. For example, if you have inflammation in the gut, that's going to greatly reduce your absorption rates by up to 60 to 70%. Grains in your diet, refined foods like refined sugar, starches, that's depleting your magnesium. And then other things will deplete your magnesium like alcohol, caffeine, and also many medications. And of course, the top-selling magnesium products are not the best ones to take because not only do they create diarrhea, because they're a laxative, but you really don't absorb much. Like with magnesium oxide, you only absorb like 3 to 4%. The one I would recommend is magnesium glycinate because that's the one that you absorb 80% and it doesn't create a laxative effect. And the glycinate part of it will help you sleep. Magnesium is one of the master controllers over calcium. You see, calcium has other purposes other than just making your bones strong. Calcium is also used in the body as the main communication signal between cells. And far too often we accumulate too much calcium inside the cell. And if there's too much calcium in the cell, those calcium crystals start damaging certain parts of the cell. Literally, we calcify as we get older. And you may have heard of the vitamin K2 being the antidote for that because vitamin K2 helps to keep the calcium from accumulating in the arteries. But magnesium is even more important in helping to regulate excess amounts of calcium. Another thing that magnesium is really good at is preventing kidney stones. It has 100 times more binding force to the oxalates than calcium. And then let's talk about muscle. It's the calcium that causes muscle to contract and magnesium to relax. So anytime you have a tight muscle, that means you have way too much calcium, but really it's low magnesium, preventing heart attacks, but also preventing any type of problem with the rhythm of the heart. You can correct atrial fibrillation by taking enough magnesium over a period of time, but sometimes it might take months before you really correct that deficiency. You can't correct a very severe deficiency of magnesium by just taking the maintenance dose. Sometimes you have to increase it to 1,000 to 1,500 or more milligrams every single day over a period of months. And this also includes dealing with things like migraine headaches, pain problems like fibromyalgia or pain syndromes. They require a lot more magnesium. And also mood disorders, people that are depressed or even have diabetes. Magnesium greatly helps blood sugar. It's probably because of the demand that a high blood sugar situation creates on magnesium. It depletes magnesium. So the requirement of magnesium, it's much higher for a diabetic. Now let's get to the 3 secrets. Number 1 is we used to get a lot of our magnesium from hard water, whether it's from a spring, a well, and then we decided to filter the water like in city water or send the water through a water softener, which actually removes the calcium and magnesium and replaces it with sodium and potassium to make the water less corrosive on the piping and less harsh in washing your clothes. People don't consume hard water anymore. In areas in the country where they don't soften the water, they have much less risk of getting heart attacks. And then if you compare that with areas that do use a lot of water softeners, their risk of heart attacks go up. Okay, secret number 2, vitamin D won't work without magnesium. If you're increasing your magnesium, also increase your vitamin D, and that way they will both work. And just as one side note, vitamin B1, which is really important in reducing stress and gets depleted when you consume a lot of carbohydrates, that also is dependent on magnesium. So when you take more B1, you need magnesium to allow that to work. And then the last and most important secret, magnesium has a super important role in some of your biochemistry. Deep in the cell, you have all sorts of motors that do the work of the cell. Like the one in the mitochondria that literally spins 200 to 400 times a second. It generates ATP. ATP is the energy currency of the body. And so your energy levels, your fatigue is related to how much magnesium you have. So yes, magnesium helps lower cortisol, it helps you sleep, but it also gives you energy. And if you have any type of fatigue, it could be because you're deficient in magnesium.